Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's video, we're going to be discussing the medication known as Atazanavir. Its brand name is Reyataz. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. Now, during this presentation, we'll discuss the mechanism of action or how this medication works, indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe Atazanavir. We'll then discuss examples of dosing, and then finish it off with side effects with percentages. I put together some slides to go over this information, so let's just jump right into it. So the first thing to discuss here will be the mechanism of action, or how this medication works. So Atazanavir is an azapeptide HIV-1 protease inhibitor. It prevents the cleavage of GAG and GAG polyprotein, yielding immature, non-infectious virus. In terms of indications or reasons we would prescribe this medication to a patient, well, we would often see it prescribed in the treatment of an HIV infection. With respect to contraindications or reasons we would not be able to prescribe Atazanavir, well, we wouldn't give this medication to a patient who had a hypersensitivity to Atazanavir or to any other component of the formulation. We should also note here that there are many drug interactions, as an example, strong CYP3A inducers that may reduce exposure or efficacy of Atazanavir. Now for examples of dosing with Atazanavir. So in the treatment of an HIV infection, in a treatment-naive patient, we may see Atazanavir 300 mg with ritonavir 100 mg orally once daily with food. In a treatment-naive patient that is unable to tolerate ritonavir, we may see 400 mg once daily with food. In a treatment-naive patient using efavirenz, we may see Atazanavir 400 mg and ritonavir 100 mg orally once daily with food. And finally, if we see a treatment-experienced patient, we may see Atazanavir 300 mg with ritonavir 100 mg orally once daily. As with all medications, there are some side effects or adverse reactions that patients may experience while using Atazanavir. So we'll go over some of those here now. A rash may occur in 3 to 7% of patients, while abdominal pain may occur 4% of the time. 1 to 3% of patients may experience diarrhea, and nausea comes in at 3 to 14%. Vomiting at 4%, and hyperbilirubinemia would happen in some patients, as well as jaundice. Myalgia or muscle pain may happen 4% of the time, and a headache may happen up to 6% of the time. Some patients may experience a cough, and 2% of patients may experience a fever. Some more serious side effects would be diabetes mellitus, Stevens-Johnson syndrome, or atrioventricular block. Alright everybody, that's all we're going to talk about today with Atazanavir or Reyataz. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable, you'd like to help grow this channel, remember you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. So for today, take care.